Meantime, the House bill has drawn starkly different responses from the insurance industry and the medical community. Senior correspondent Marie Denoya Aronson has a reaction.
The House may have resolved its debate over the weekend, but New Jersey stakeholders from insurance companies to doctors' offices are at odds about the merits and drawbacks of the reform outlined in the bill. It would require most Americans to carry insurance, providing federal subsidies to those who could not afford it. Large companies would have to offer coverage to their employees. Insurance companies would be banned from denying coverage because of medical conditions and would no longer be able to charge higher premiums on the basis of gender or medical history. The most controversial aspect, the bill would allow the government to sell insurance, the so-called public option. The New Jersey Medical Society has issues with this.
We see it as a step towards socialization, for example, where the government maybe starts off by laying down some groundwork, but eventually it expands and becomes, affects decision-making on a daily basis.
But that's not the most concerning issue for William Marino, CEO and president of Horizon Blue Cross Blue Shield of New Jersey.
Beyond the public option, we think that there are many provisions in that bill that will actually raise costs, not lower costs.
Marino cites a number of examples, though he says the insurance industry supports eliminating the pre-existing condition exclusion. He says it only works if every American is required to have health insurance. An amendment to the House bill has weakened that provision.
If you're eliminating that exclusion, covering everybody when they apply, and you don't have a requirement that people get coverage, that means that costs are going up for the people that do have coverage because they're going to be paying for individuals that apply at the last minute when they know they've got a serious illness, and that will drive costs up.
There is deep division among the physician community. The American Medical Association issued a statement hailing passage of the bill, saying it will help improve the health system and characterized the bill as a big step forward. But again, the Medical Society of New Jersey is not as supportive.
New Jersey is unique in that we are the lowest reimbursed state for Medicaid as it is right now. The government option, or the public option as they're talking about, will probably expand the Medicaid population, which is traditionally a very low reimbursement rate for us.
But the New Jersey Healthcare Quality Institute is supportive of the bill.
I think it's about time we got health reform so that people do not have to live without health insurance. It's an insanity in this country that people don't have health coverage. So this was a momentous weekend.
I think the closeness of the vote in the House is a statement that the country really is split on the issue.
Further indication of that division, questions surrounding the Senate, its version of the bill, and its timetable for taking it up. Marie Denoya Aronson, NJN News.